Reawaken to your immortal identity and discover life between life's wisdom. Presented by the Michael Newton Institute.
Dr. Atilio Costa Vitali is the Medical Director, Heart Failure Disease Management Program and Medical Director, Arrhythmia Program at the Health Sciences North in Ontario, Canada. He is also a hypnotherapist who beautifully bridges the connection between the medical practice and clinical hypnotherapy. Hi, everyone, and we are back once again with another beautiful, very interesting soul who's joining us today in the Wisdom series, discussing his journey, discussing his experiences. And welcome to Attilio, who's joining us all the way from Toronto in Canada. Attilio, thank you so much for joining us today and for sharing your time, your experiences, and your energies with us.
Thank you very much for having me.
I'm very keen to know if you would like to share with our viewers, what do you do? What are you primarily known as? And, you know, you were mentioning that, and I love reading about it, where you're a medical practitioner who specializes in the world of what we call the cardiac aspect, or the world of the medical understanding of heart. And then you have spiritualism, because you also practice spiritual hypnotherapy.
Mm-hmm.
Please let me know about your journey. Where did it all begin and all of that? Who is Attilio?
Wow, who is Attilio? Well, I like the way you describe it. It's a journey, because actually that's the way it was. To be honest, I think that you are put a path in front of you and you have to walk with the least resistance that you have. And yes, I'm a cardiologist, and I don't think I'm a cardiologist just randomly. I think that I was put that option in front of me, and I just had to go with it. I am a cardiologist, but I specialize in something extremely, not extremely, but something very specific in cardiology, which is the arrhythmia world. So I am an electrophysiologist, an arrhythmia. And when they say spiritually, if you just don't think mainstream, but just go spiritually, that people have arrhythmia problems when something is out of balance, and it is exactly what I see in my daily practice. Of course, I do not, I have to be mainstream physician, so I don't really apply spirituality to every single patient that I have in front of me. But I try sometimes to go through the back door when I talk to patients, because there's always something that is out of balance in their life. I think that people who suffer from cardiac problems, they have an issue with love, and that's something that that I was told once by an extremely wise woman that I met in Lisbon, in Portugal, and she is. I don't know if you ever heard of somebody called Chico Xavier, but Chico Xavier was a very, very famous spiritist in Brazil. And he wrote, although he never went to school, he wrote over 150 books because he was able to communicate with different souls. And he would just sort of start typing or writing, and he would go into a trance, and he would just communicate that way with the spirit world. Well, this woman that I met in Lisbon was exactly the same. And one day we became friends after a long time, but at the beginning, when I first had my first session, she sat with me, and without me telling her absolutely anything, she said to me, "I'm glad that you are dealing with problems of the heart, because people who have heart problems have an issue with love." And that resonated with me for a long time, for many years. And I wanted to try and understand what that meant. And that was when I was 33 years old and 48 right now. And still that those words resonate with me, because when I sit in front of a patient, for whatever reason, that always comes to my mind, issues with love. So it's very interesting. And I've seen that, in some patients or some clients, that they're more spiritually open, and I offer them to do psychotherapy, to do hypnotherapy or family constellation, with something that I'm also doing right now. You can see that there is an issue with love somewhere in their family map or in their life. Yeah.
It's so interesting you mentioned two modalities, family constellation and spiritual hypnotherapy. Now, I happen to practice both myself as well.
Oh.
And so when I was listening to you, I remember a very interesting session that I did with a client. So she's a girl who is herself very spiritually aligned. She's a person who comes from the background in the world of therapy, and she also happened to have diabetes. And somewhere in her conversation, there was a possibility of a belief that someone in the family has, therefore I have, and there was a sort of intellectual acceptance of it. This is where she was coming from. But when we have been working, we found that there was a lot of heart-related issues that were popping up. And you know how it is. She's been through a relationship issue. She had lost a parent early on. So there was a lot of places where the heart healing aspect was coming in. And I did one of these, I call it a bizarre session, because I mixed family constellation with inner child healing and spiritual healing. And we got into a place where we did a constellation with the different organs and systems of the body. And it was so beautiful how the heart spoke.
It is. It is.
But what is, since you were talking and you come from a world of both medical as well as complementary healing, is the way her sugar readings have been lately. To the extent that I am actually waiting for her to give me the next feedback that she gives me from her doctor, because she's been on insulins. And her deal and her goal is if she can completely heal and be cured. Which brings me then to my next curiosity. I'm not saying question, but curiosity, that when you have ever brought in hypnotherapy into the space of healing, you coming from a background of medical practice, how much do you envision, or how much do you guide your clients to envision the heart actually healing? I'm talking about the organ, because it is just so beautiful that when we do body talk, or when we do constellations or any kind of spiritual hypnotherapy, and then the body, the physical body gets involved, it's amazing what the body tells us. I'm curious to know yours.
It is. One of the other things that I do as a cardiologist is I treat patients with heart failure. Heart failure basically means that the heart is tired of working, is tired of basically working and just giving it up. And although it's a disease that it happens lots in for some reason it's growing exponentially in the 21st century, it's a disease that also has a connection deep-rooted in spirituality. So what I see in my patients is that, again, this is something that I only deal with some patients who are very open to spirituality, because the majority, unfortunately, they are not. And although I'm doing some research right now with, have a research fellow working on, it's not a spirituality aspect, but it has to do with cognition aspect. There is a taboo in the society just to get their cognition assessed, because they feel that if they get their cognition assessed, that means that they're going to be labeled as with cognitive impairment, and that's going to affect a lot of things, especially their financial freedom, etc. And that creates a lot of problems, because the majority of patients don't want to get that tested, and that is just a test that is widely accepted, just a way to assess your cognition. If I talk to them about spirituality, they will never come back. So it's really, you have to be very careful with what you do. But I do have, I would say, 3%, 5% of my practice are patients who spontaneously they open up to the spiritual world. And because I did some research in the past, and actually I gave a talk on something I was working a few years ago, which is near-death experiences. And I did a small research in my hospital, and I presented that work in the hospital. So people started to know me for that aspect, which is near-death experiences. So patients come to me sometimes to tell me, hey, you did that work. I read about it. I had a near-death experience. I wanted to participate if you do it again. And those are the ones that have heart problems. I see that they're open to spirituality, and I try to work them in a different way. But I'm going to tell you this, that even if patients are not open in spirituality, if you apply your technique somehow and you get through the back door in their lives, trying to understand what's going on, at least if you apply some of your quote unquote spiritual wisdom, if I may, then you can help them to accept where they are right now. I think that one of the main problems is that patients and us as human beings are not able sometimes to accept the things that we have in front of us, the things that are happening in our life. And we believe that happiness depends on the things that are happening to us right now, you know? And I think that it's very important to try and understand that it has nothing to do with happiness. You know, philosophers used to say that the only thing that you can control is the way you feel in front of the things that are happening to you. And that's something that you have 100% control. No, and in my practice, what I see, because I deal with very serious medical problems, you know, heart failure, arrhythmias, things that are life-threatening. The majority of patients, they just do not accept it. And this is something very interesting, because the moment you release, the moment you let go, the moment you say, okay, and whatever happens, happens, is the moment where you stop fighting, and when you open the door to actually healing.
True. So true. So true.
Yes.
You know, can you tell us about any very interesting case or cases possibly where that moment that inner light awakens, or the person, the patient acknowledges that opening of that moment? Because it's such a beautiful moment when you're actually, as you said, you opened it and you're in the flow, and that release or that surrender is so powerful. And as you said, what you are constantly dealing with are very life-threatening cases. And so these are patients who we would call very high up there in their realm of seriousness of what they're coming with. Is there any particular case that you would like to share with our viewers?
Well, yes, I have a few, but I have one that is very extremely interesting, and actually is a friend of mine. It's not a patient. He's never been a patient of mine, but he is a friend of mine, and I got to know him for the last maybe year or so. Him and his wife are beautiful, beautiful people, and they were in my house maybe a month ago, and we were just talking. At that point, I didn't know much about their personal life. We were just getting to know each other, and he told me the most beautiful, amazing spiritual story that I could hear. So he was diagnosed with terminal cancer, and he was only given 6 months to live. And up until that point, you know, they were a younger couple, so they did every possible thing, any imaginable thing, just to try and save his life. So of course he went through mainstream science, and then he went to do some treatments in Germany. So he had to spend thousands of dollars for something that didn't work. Then they were just about to give up, and he said he had a family meeting with his wife and kids, and he basically was saying goodbye to them. And he said, you know, this is it, this is the end, and I just want to enjoy life with you guys for one more trip. So all of them went together to the Caribbean and had a fantastic time there. And at that moment is when he said, that's it, I'm giving up. You know, this is it. I don't have any other choice in life. I'm given, you know, a few more months to live, and and that's it. I will live my life to the fullest for the next few days, few months. Without realizing that when he said that and he felt that, he started the healing process. And then when he came back, they came back to Canada. Took maybe 6 more months, and he then realized that instead of he dying, he was actually getting better. And it was extremely interesting, and that's something that I wanted to talk. He just released a book. I have not read the book yet, but I want to read the book, and because he tells his story in that book. But I think that's where the healing process started. When him realized, first of all, he was a warrior. He really fought. He really tried to, even he tapped into spirituality, trying to solve his problem. But I think that the problem came, the solution came from within. When he realized that it's okay to die. It's okay to die. That's when he stopped fighting and just let things happen. And that's what happened. He healed. So it's a very interesting story. Very, very interesting story.
So I think, what's so beautiful about what you said is that when we accept the flow of life, death doesn't really stop it. There's a shift that the soul goes through, and then there is a continuity.
Exactly, there is a continuity. Yes.
So
because when you resist,
because there's a fear of death that an average human will have or does tend to have. There's always that the fear of dying. One of the key things that we've seen people go through, and especially when we've seen people suffer, cancer patients, and even there's this whole fear of dying. I think that we see in a lot of cases and patients, and those who go into that space of surrender, that it's just a shift or a move or a change of environment that I'm going to go through, or a change of state that I'm going to go through, a dimension or a frequency shift. There's a very tremendous power that they exude after that. And that power, as you just mentioned from him, possibly is where he went into a space of healing even without him realizing.
Exactly. He didn't realize, and he's not a spiritual person. He's just somebody who tapped into that reality. And the way he did that was just by accepting, by accepting. Because at that moment, I think that, philosophy, they say that, when we do something in life, we actually do it from the perspective of love or from the perspective of fear. That's it.
Yes.
So, and everything he was doing was from the perspective of fear, because he didn't want to die. But then when we switched that, when he transformed that into love, that's when the healing started.
Yes.
Because he was accepting, he was open, he opened up. And I see that a lot in patients who, they're in a moment of they're dying and they resist. And you at some point you see them, they don't suffer anymore. That's a moment when they accept. Yeah.
I'm so with you, because I remember going through a very painful health issue which involved my lungs many years ago, actually in 2005, Attilio. And I remember in the ICU, I was told all this later, that they were pretty much struggling to diagnose what the issue was, but obviously there was a system collapse that the body was going through. And if I now put it all together, it was a year where I've been through one after another heart-related hits, losing loved ones, myself going through a lot of pain in my personal space. But when I look back at life, if I look at that journey of 3 weeks in the hospital and in the ICU, and not quite knowing what is really so wrong with me, but being able to ask for things like a birthday cake, because I was in the hospital on my birthday, and asking for things like a cold coffee, things you're not really allowed, but the doctor indulged. And every time I was being indulged, I used to think, I'm possibly going to die, which is possibly why they're just letting me getting away with all that I'm asking for. I'm just being pampered. Yeah. But today, when I look back, I realize the me who came back home from hospital in 2005 was a very changed person. So I had to go through what I went through, but it's so true that the moment you start to do things out of love without going into the realm of what fear can bring, it's the most liberating experience any individual can go through, because it's not like we don't have hits after that in life. We do, but we bounce back faster because it's not fear that controls or governs us, but it's the values or the principles or the rules of life which are based on love that one is going through. And there's always evolution. We're always changing and shifting anyway. So any experience we went through, you know, whether it's a brush with cancer, whether it's questioning, okay, why am I, that question people go through, which I've heard so many people say, why am I going through this? And in that why, there is just so much of liberation if one is willing to see it with love.
Yes, exactly. Yes, it's to go through life, through every chapter of life, just with knowing that you have to accept it. That's part of the journey. That's how you heal. That's how things just go. That's how you take off that weight off your shoulder just by accepting.
Acceptance, exactly. Yes.
Except without
What I'm so curious to know, what brought you into spiritual hypnotherapy in your journey till now?
Well, yeah. Well, this is it's a long story, but just to sum it up, I think I've been a very spiritual person since I was a little kid without even knowing.
Okay.
I remember that I used to have, and then I understood much later in time what it was. But when I was very, very young, I was 7 years old, 6 years old, I drowned and I had a near-death experience myself. It was not a full-blown near-death experience, but I was drowning, and I do remember as if it was yesterday or an hour ago, me going down. Basically, I was by the edge of the pool, and then I was very little, and I just tripped over into the pool, the swimming pool, and there was nobody in my house, only my dog, and the dog started to bark and bark and bark and bark and bark, and my brother was in the house, and he was 5 years older than me. He came and rescued me, but he came, you know, like 10 minutes later, not right away, so I had time to drown. So, and I remember going down that at some point, I don't know, maybe because I was such a little kid, I was not fighting. I was not fighting, you know, it's completely the opposite as was happening now when I see a patient. We learn, I guess, to fight. At that point, I was not fighting. I was just accepting that, I was even accepting that, yeah, that's it. This is my end. And at some moment, at some point in that experience, I felt extreme peace and connection, and it was lovely. It was really, really fantastic. That experience, it was like everything got still. Everything was still, and it was peace and connection. Was fantastic until my brother took me out of that reality. But that's where it all started. And I don't know what I tapped in, you know, when I was down there, but I had very interesting spiritual experiences when I was a teenager, and I just didn't know what they were. They were very, very scary. And, you know, fast forwarding, you know, 20 years later, I met a friend, a very good friend of mine, who is a psychiatrist, and actually he's one of the most spiritual persons I've ever met in my life. You see, that's the thing. You meet somebody in life because there's something that you have to learn from them, or there are triggers, or they just say, hey, don't forget, you're a spiritual person. You know, you have all the things, you have to use them. And he still is an amazing spiritual person. He does psychiatry in Lisbon, and he uses a lot of his spirituality to treat patients. Actually, he just opened up a ketamine center in Lisbon. So with him, I mean, we became very, very close. And actually, he is the one that sort of woke me up back to my spirituality, because he had the same type of experiences when he was a child. The same type of very interesting, weird, you know, experiences that he could not put a name to it, and I didn't. But I closed the door. He didn't. And that's probably the reason why we met, and that's how it all started. We did spiritual trips with him. We did ayahuasca treatments, ayahuasca retreats with him, a lot of things with him. And that's how it all started. And then we did a training in New York with Paul Aran.
Yes.
And yes, and it was a fantastic training. It was a beautiful training. That was like 10 years ago, and that's how it all started, and then I did some further training here, then I did some further training in Europe, and that was the spiritual aspect of it. And then I had to retrain to do the non-spiritual aspect of it, which is the things that I do, to treat obesity, depression, all the things that come with the disease that patients have.
Yes, yes.
That's how it all started.